I think we're really in the renaissance of what I like to call non-invasive treatments for appearance-related issues. Patients are less likely to want to have a facelift or something done on their body and are really looking at healthier skin.
There's a couple things that have changed over the past, say, 4 to 5 years. They're very interested in things that have minimal downtime because they understand now that they actually work. They demand relatively effective treatments. So minimal downtime and minimal results doesn't fly. But minimal downtime with great results, boy, they love that. And they're willing to pay proportionally.
So now you can match your face and body to how healthy you feel on the inside without having to undergo very drastic treatments.
Whereas I would say most people just immediately went to the end result, which was surgery. They're really now breaking it up into 3 levels, and they're kind of coming in that entry door with the skincare, basic skincare, taking care of it, getting it in its best health and shape and certainly physical appearance. The non-ablative, which is a little bit more aggressive, a little bit more expensive, and then all the way to the end for the permanent surgical.
I think in the beginning there was a pretty narrow window, say age 40 to 60, maybe even 45 to 55 or 60. And what we've noticed is the shoulders of that age group are expanding.
My younger clientele now starts as a teenager. So there's a market for everything from acne treatments to basic skincare.
But that younger group tends to sort of be very educated when they come in, whereas the older group, their friends had something done and they want to look like them.
There may be a group of individuals who say, look, I use sunscreen and I'm using prescription retin-A, but most, in fact, are not using either. And they come in, that's what they need first. Every patient gets told about prescription retinoids, every patient that I see, and sunscreen. But those patients would do well with this procedure if it was less expensive, less involved, straightforward, and made their skin brighter and more even in color. And there'd be a lot of women in their late 20s, but especially early 30s to mid 40s who would actually like this.
I would say one of the most popular things is microdermabrasion for our younger clients. Skin brightening, skin lightening, that's the buzzword right now.
There's that younger patient who wants something done, but is not quite ready yet for a full-on Fraxel treatment. That's a huge demand for healthier skin, even in the 20-something, 30-something person that wants to maintain what they have.
There's a couple of variables that come in. How much space does it take up? And then what's the value proposition in the time it takes up? Right? Because if you're going to do a procedure that takes an hour, well, that hour can be used one of several ways. It can be done by an esthetician who maybe generates a certain dollar amount per hour, and maybe it's done by a nurse who does a laser or other treatment that generates a slightly higher revenue per hour, or maybe there's a doctor doing general dermatology or cosmetics. And every practice has that decision to make. How are they going to use that room? So devices that take up a small amount of space can be done by a non-physician and generate a reasonable revenue per hour. That's sort of the holy grail of what we're looking for.